Good afternoon, everyone, and welcome. I'm Ruth Christopolsky. We're very, very pleased to have you today to our Employer Town Hall Part 12. Really having a conversation today about returning to office, some of the current events in our environment, and then some requirements around masking and around vaccines. We have a wonderful group of individuals, very, very highly accomplished folks to join us today in our discussion. First, we have Dr. Katie Passaretti, who's the Medical Director of Infection and Prevention at Atrium Health, and she's going to give us an update on new guidance and then just a general overall update. Diane Graves, who's an Assistant Vice President in our teammate relations area, is going to speak to us on the Atrium Health vaccine requirement for teammates and walk you through the process that we used as we were making decisions around vaccine requirements. We have Nicolette Davis, who's a assistant specialty medical director in our occupational medicine area, and she's going to have a few minutes to talk to us about returning to the workplace safely. Dr. Steve Limentani, who's an associate medical director in our employer solutions area, is going to speak to everybody around addressing mask and vaccine resistance. As we usually do, we are recording today's meeting, and it will be available for you to use with your teams. Following the event, we'll make sure that we push both the slides as well as the meeting recording out to you. Also, please feel free to type into the chat at any point in time during our discussion over this next hour any questions that you might have for our experts to answer. We'd love to be able to respond to any questions that you have, and quite frankly, if we don't have the answers, we'll make sure that we go back and find them for you. So I am going to turn the floor over to Dr. Katie Passaretti to give us some updates and new guidance in this space.
Great, thank you, Ruth. So there's been a whirlwind of new information over the past couple weeks. So I'm going to go through this quickly, but happy to take questions in the chat, as has already been mentioned. Just to level set, we are at a very tenuous point in this pandemic. So this slide just shows the trends in number of new cases in the United States. And you can see, as we have all likely experienced in our workplaces and in our communities, that we are seeing a very steep increase in number of cases of COVID. This is hitting particularly hard in areas with lower vaccination rates. Next slide, please. This is the parallel slide showing COVID-related hospitalizations in the United States. And again, you can see the very steep incline that really just started hitting at the beginning of July and is rapidly ramping up, approaching 2/3 to 80% of where we had been at the worst of the pandemic in the winter months. Next slide. This is just kind of a summary of where we stand as far as vaccine uptake in North Carolina and some of our, at least in the Atrium area, surrounding counties. So, we range anywhere from a low of 32% to a high of 48% in our general area as far as fully vaccinated individuals. So are considered to be part of those areas with lower vaccination uptick, and certainly are seeing the repercussions of that as far as cases and hospitalizations in our area. Next slide. This is a slide I snipped from the CDC presentation that just shows by state the percent of state population vaccinated, and in the end of July, the 7-day case rate per 100,000. And again, as kind of I referenced in the prior slide, the states in our general area are in this lower vaccination chunk of the country that is getting the hardest hit right now as far as COVID trends, cases, and hospitalizations. And this recent increase obviously is closely associated with the rise of the Delta variant of concern. Next slide. So this is just a pretty unfortunate map, actually. So, the CDC came out a little while ago, and Dr. Limentani will speak to kind of current masking recommendations. But this map, the red areas, which is essentially all of the United States, shows areas that have high amounts of community transmission of COVID. And unfortunately, regardless of vaccine uptake, pretty much every area in the United States is either moderate or high community transmission. Next slide. So, I get often asked, how do we know that Delta is contributing to this? What's the data on Delta and whatnot? What are we learning about the Delta variant of concern? So, COVID has gradually changed and mutated over time, and until recently, those changes have been relatively clinically insignificant, but Delta, that has changed significantly. So the Delta strain is this orangish color that is called B1617.2. And you can see just starting kind of mid-June, when the Delta variant was barely accounting for any of the strains that were typed in the United States, it has now in recent weeks completely taken over. So pretty much every patient that is typed by the CDC, by the state, by local measures, is that Delta variant. And this matters because Delta acts differently than other variants. Next slide, please. So multiple studies now have shown that Delta spreads more effectively than earlier strains of COVID. So whereas if I was infected with a prior strain of COVID in a room full of people who were susceptible, in the past, I might have infected 2 to 3 individuals. If I'm infected with Delta, I may infect 6 to 9 individuals. So about 2 to 3 times more transmissible with Delta than it was before. So that means more people infected, more cases in our community, more hospitalizations. Delta has also been associated with higher amounts of virus in the individuals infected, again, contributing to that spread within communities. And this, graph is busy, and I won't go through the details, but essentially shows that compared to earlier strains, Delta, when you're exposed to someone in your household or out in the community, you're more likely to become positive if you're exposed to someone with a Delta variant compared to earlier strains of COVID. Next slide, please. The other unfortunate news with Delta is multiple studies now have shown that Delta is associated with increased severity of illness, so increased rates of hospitalization on the order of 2 times, higher ICU admission, and higher risk of death. So, we are very definitely still learning, but early data suggesting not only more transmissible, but also more higher severity of illness. Next slide, please. And also starting to see data that with Delta being slightly different from older strains, the risk of people having a second infection with COVID, so someone infected with an earlier strain of COVID gets infected again, the risk of that is higher with Delta compared to earlier strains. So that natural immunity, natural protection, probably not surprisingly, seems to be less based on early data with the Delta variant of concern. Next slide. The other piece that is important to look at, so we've talked about some of the clinical characteristics with Delta. So if it's chipping away at, ability to cause reinfection, severity of illness, what's the impact on vaccine efficacy? So unfortunately, because we kind of partially vaccinated our communities when we had the chance, Delta has evolved, and we are seeing increased post-vaccine mild cases. And you can see some of the numbers up there ranging from anywhere from 50 to 87% compared to the 95% we saw with the initial vaccine studies. Now, what I want to emphasize is that this does not mean that the vaccines don't work. A vaccinated individual is still significantly less likely to get infected. And the other piece to know is that the vaccines, even if chipping away at the protection against mild illness, continue to provide marked protection against severe illness. So hospitalization and death, predominantly over 90% of the time in most studies, is in individuals who are unvaccinated. Next slide. The other thing that I'll just kind of put some context around and advocate for, when you all are looking at news headlines or information about post-vaccine cases, please remember when you look at that, it's important to take into account the population that is being evaluated. So if there is high vaccine penetration, and one we were talking about right before we jumped on this call is the Provincetown, Barnstable, area that had a fairly significant outbreak associated with group gatherings. That population has very, very high proportion of vaccinated individuals. So a good number of people in the outbreak were vaccinated, but that's a function of the population that you're drawing from. So just context is super important when you're trying to weave through news headlines, when you're trying to kind of read through this information, and just, keep that in mind so that correct conclusions are drawn. Next slide. This is some of the CDC data from updated as of end of July on vaccine breakthrough hospitalizations and deaths, kind of reinforcing what I said. We are seeing a little bit of an uptick with Delta in post-vaccine infections, but that vaccines continue to be very protective against hospitalization and death. And that's true for all of the vaccines currently available in the United States. Next slide. This is just some local data. So, for Atrium, I look at all of the admissions, all of the deaths, and again, we're continuing to see, even this most recent month, over 94% of COVID hospitalizations and deaths are in the unvaccinated individuals. For vaccinated individuals, those that tend to, if they're in those few cases where there are hospitalizations, tend to be older individuals with multiple medical problems, specifically kind of transplant type patients, advanced diabetes, those kind of groups. Next slide. So just to summarize, Delta unfortunately has put us in a very, very tricky position in our area and in the United States. And, honestly, hospitalizations have increased to a level that has put our hospitals at significant risk, and the importance of protecting our communities, preventing hospitalization and death cannot be underestimated, nor can the fact that the best way to do that continues to be vaccination. Delta is more transmissible, has been associated with more severe disease and higher rates of reinfection, and vaccines, while you may have a mild breakthrough case, continue to be very protective against hospitalization and death. For now, until we do a better job at getting our population vaccinated, you're starting to see the return of the importance of masking. So we just encourage people that masks for right now, until we get things under control, are really important in, protecting our healthcare system and keeping us functioning. Next slide. I'm going to switch topics a little bit. So with all the information that's coming out recently, there has been a lot of media and recommendations surrounding either third dose or boosters. So officially approved by the FDA, ACIP, CDC are a third dose for highly immunocompromised individuals. And those people that meet those criteria are listed on this slide for your review. So we know that immunocompromised individuals, their immune system is not at a point where it can mount as much of a response as someone with a quote unquote normal immune system. So it has been shown that a third dose in some instances may help protect those individuals. So in many areas, and now as of maybe an hour ago in my Atrium, those who are highly immunocompromised can go ahead and schedule a third dose if they meet those or attest to meeting those criteria, so that they are protected as much as we can. I will say immunocompromised individuals, even with 3 doses, still need to be cautious because their immune system may respond to that third dose and have a higher likelihood of doing so, but it's still important, especially with so much activity in the community, to continue to be safe. Next slide. The current third dose recommendations for immunocompromised are limited to mRNA vaccines. We don't yet have enough data for Johnson & Johnson. The recommendation is for individuals to get try to stick with what they got the first time around in the mRNA. So if they got Pfizer, the third dose should be with Pfizer if possible. If they got Moderna, should be with Moderna if possible. People should be waiting at least 28 days after their second dose to get that third dose. And again, would just continue to reinforce infection prevention measures. More recently, you may have heard in the popular media that boosters because of waning protection from vaccines may be recommended in the not too distant future, but that has not yet been approved by the FDA or CDC. So over the next couple of weeks, we will learn more about that. Preliminary information suggests that the recommendation will be 8 months after the second dose, individuals may be eligible for a third dose of the vaccine they initially got vaccinated with. Again, acknowledging that protection both after natural infection and vaccination may kind of come down over time, and that that booster dose may help kind of buff that up and prevent against mild illness. Next slide. The final thing I'll say, we are unfortunately quicker than many of us feel comfortable approaching our usual respiratory viral season, flu season. So, I think as discussed, last year, unfortunately, heading into respiratory viral season where many areas masks and kind of distancing have been thrown out the window, there is concern that we may have run into tight problems again if we are still in the thick of things with COVID and then throw a normal respiratory viral season on top of that. So we just advocate for not only, working to get your employees or friends, family members, whatever, vaccinated for COVID, that very soon people will also need to get vaccinated for flu. I will remind people that back when vaccines went live for COVID vaccines went live for adolescents, the recommendations changed about when you can give other vaccines in proximity to the COVID vaccine. So you can give flu shot and COVID vaccine at the same time in different arms. That is allowed, and I think will be super important as we head into respiratory viral season, potential boosters, trying to continue to get people vaccinated. So we'll just kind of make sure people are aware of that. Make sure you're reinforcing the things that, regardless of COVID or other respiratory viruses, provide protection, which is making sure people aren't working sick, masking where appropriate, distancing where appropriate, and good respiratory and hand hygiene. Just reinforcing those is always good practice and will be even more important over the coming months. I think that may be my last slide. Yep, so I'll pass it over to Diane to talk about her things.
Thanks, Dr. Passaretti. Thank you, everybody, for having me today. Just a little bit about myself. I am a St. Louis native. I moved to Charlotte 2 years ago to take the position of the AVP of Teammate Relations for Atrium Health, and I've enjoyed every minute of our last 2 years together. I want to walk through our journey to our vaccine requirement. I know this made the news, and lots of people are very curious about how we came to this conclusion, but we started in January of this year when the vaccine became available to all teammates. We started our education campaign, making it easy for folks to get the vaccine and as convenient as possible, and working through building our existing, working through our existing tools to build new tools on how to request appointments and how to get through the medical system in order to get the vaccine, and then providing teammates with work time if they needed it to get the vaccine, having multiple locations for folks to get vaccinated. Also, helping anticipate, especially after the second shot, if a teammate was not feeling well, helping leaders and teammates anticipate that they might need a day off or so, and working through those issues as well. We spent a lot of time communicating, took a very positive approach to our teammates, and educating our teammates both with webinars and websites and FAQs and you know, and teammate and leader huddles. So lots and lots of education. I know Dr. Passaretti did a lot of that work for us, so definitely thank you. In June, we started noticing that our vaccinations were lagging. We had a goal to meet, to have 75% of our teammates vaccinated by July 4th. Our goal, we were not meeting our goal, so we were putting in some extra efforts to try to figure out if there were pockets of teammates or maybe teammates who didn't have access to media or access to, you know, easy access to websites, you know, trying to identify where are those folks. And then going to them with the vaccine, offering them, you know, vaccinations, you know, at work, during break times, things like that, to try and increase our vaccination rate. We did, you know, make a slight improvement in our vaccination rate, but still not where we want to be. And then considering what we just heard about the Delta variant and the higher contagiousity rate, and also, you know, that it makes folks sicker, just thinking through, you know, as a healthcare provider, how do we want to approach this from, you know, from a patient safety and a teammate safety approach. So, you know, we did that additional outreach and kind of recognized that a requirement was going to be essential. Next slide, please. So we did a lot of research. We talked to other health systems that had a vaccine requirement. We did not take this lightly. We understand there are folks who have legitimate reasons why they don't want to take the vaccine. We did a lot of talking points for our leaders and teammate engagement to talk about, you know, the myths that are out there about the vaccine and help, you know, identify, you know, what are the facts versus the mix. There were also, you know, feedback from our medical experts, you know, our commitment to the health and safety of our teammates and patients. And we have an existing infectious disease policy, which includes the flu vaccine that we do every year with our teammates. So we had a process in place that we were able to leverage for our vaccine requirement. Next slide, please. So information that guided our decision, we looked at our local case counts, the easier transmission of the Delta variant, you know, the seriousness of the illnesses that folks are getting. We also, like I said, benchmarked with other health systems. We looked at their policies and procedures. There's a lot of information available from other health systems about how they approach this. Lots of different folks approached it different ways. Some health systems offered incentives to teammates to show them their vaccine card. And, you know, if you show us your card, you'll get, you know, you'll get an X amount of dollars. You know, we looked at that as well. We also reviewed the EEOC's guidelines for religious and medical exemptions. And then Vanderbilt University published a really good paper. It really relates to the flu exemption process, but they talked about how they handled the religious exemption process as well. So our vaccine requirement rollout, we did an initial communication to leaders and managers. We talked about the requirement mostly from a positive perspective. So, you know, our thought was that, you know, we would ask our teammates to, you know, very strongly consider getting the vaccine, and didn't want to talk about consequences until we got through the announcement and then, you know, the availability of the exemption process. So we built in a lot of time into our process so that we could, you know, that teammates would have ample time to get their questions answered as well as be able to comply. We've done a number of webinars and educational events across our system, and also engaged some teammate ambassadors who had some great information and launched some peer-to-peer conversations. So we have a chat site where teammates were asking questions and getting their questions answered. We also have basically, you know, open emails, so lots of us are getting lots of emails with questions, and certainly, you know, trying our best to, you know, guide folks to the FAQs and other things that had our standard answers. And we have an HR service center also that can answer questions for our teammates. From an administrative perspective, like I said, we looked at our infectious disease prevention policy. We updated that policy to include the COVID-19 vaccine. We created an exemption review committee that includes, professionals from HR, from legal, from our teammate health groups, and also our medical professionals, and started to talk about, what the exemption process is going to look like and a timeline. So setting deadlines, I think, was really important to this process. Developing a form that was electronic so that we could have a new form that people could use to create their exemption request, along with the education and an attestation that this is what they really need. And we also pulled down our old exemption process so that there wouldn't be confusion with the new process. We added a process for our new hires and our teammates who are on leave of absence, so that new hires can participate in the exemption process within 2 weeks of their employment, and also be fully compliant within 8 weeks. So a little bit of different timeline for them. But just considering our infection control requirements for those who are granted exemptions, that's still something that's quite frankly still in the works. There's lots of different organizations doing lots of different things. There's the organizations that are, doing testing weekly and, requiring certain kinds of masks and things like that. So, we're still kind of working on some of those things. Also, we just launched in the past week or so the e-training for teammates to comply with the OSHA standard that was issued just a few weeks ago. And then also looking at requirements for students and vendors who access our facility. All of this in the, in the name of safety for our patients, trying to do what's most safe with a disease that is preventable with the vaccine.
Thank you so much, Diane, for sharing that information with us. We really appreciate it. If any of you have questions for Diane, please feel free to include them in the chat and she will try to answer. I'm now going to turn the floor over to Nicolette Davis. Nicolette's going to talk to us a little bit about, as we're coming back to the workplace, how do we do that safely?
Great. Thank you, Ruth. Preventing workplace spread, a lot of this community spread with COVID, starts, yes, in the home, but it also is in the workplace. So what you all can do to help prevent the spread of COVID just really helps to enhance what we're doing from a community perspective. 20 to 25% of weekly contacts do occur at work. And what we see, the two industries with the highest average number of contacts per day, really no surprise, retail and hospitality at about 90 contacts per day, and manufacturing at about 47 contacts per day. Things that you can implement within your workplace to prevent spread. A lot of these things you've already been doing, we're just going to kind of dig into them a little bit further, talk about some items that we know work, but maybe some items that you've tried that might not be where you need to put some energy. Social and physical distancing protocols within your workplace. A lot of us were doing those to begin with. We're bringing people back. We also need to continue to implement those protocols. Mask wearing and personal protective equipment where applicable. Separation of employees while eating and drinking. We're going to talk about this a little bit further. Good hand hygiene, making hand sanitizer available in as many places in your workplace as possible, especially near doors and entryways. Soap and water throughout the workplace as well is very helpful. Maintaining a disinfected work environment. So making sure that you have EPA approved wipes for people to use on their desks, especially to wipe down keyboards, mice, desks, and door handles. Routine testing for unvaccinated employees when you can, and have a plan in place for managing these workplace exposures. More on social and physical distancing. I love these pictures because I go and do risk assessments in employer physical locations, and I really look at, okay, how are your employees sitting next to each other? More importantly, are they talking while they're facing in a direction of another employee? So in this image, you can see where we don't have people directly across from each other, but also as you're looking at cubicle spaces, making sure that even if the cubicles are side by side and you have partitions, that you really try to have people speaking in opposite directions, especially if they're on the phone frequently. We also want to look at the circulation of foot traffic, making sure that you have, if you can, one entry point and one exit point and not having people cross paths. Maintaining that 6-foot distance also when possible. You want to incorporate frequent cleaning and disinfection of workstations, those high-touch surfaces like doorknobs, copy and printer equipment, break room refrigerators and microwaves that are constantly having hands on them. Also consider staggered shifts. I know a lot of us got really excited about bringing people back to work, but bringing them back to work in a staggered way instead of bringing everyone back together at the same time is really what's recommended. Mask wearing. I know we've all been very acutely aware of mask wearing recently, so I really want to strongly encourage you to require employees to wear face masks in the workplace. Now, where it's mandated, obviously, there's really no choice in that regard. However, I really want to just kind of push this one home. So as Dr. Passarelli was talking about, with Delta variant, it replicates really, really quickly, and the viral loads are incredibly high compared to previous strains of COVID. Well, where does the virus live? It lives in your nose and in your mouth. So as it replicates really fast, we really have to be aware of protecting that nose and mouth. So it's even more important that we're making sure and we're holding people accountable for having a snugly fitted mask that's over the nose and mouth, that goes behind the ear loops and covers up underneath the chin. Also evaluate jobs that may need additional PPE, whether that's gloves, goggles, face shields, or gowns. Educate employees on how to properly wear PPE. That's a big piece of information that's really helpful. Images are also very helpful in kind of pushing that home. Separating employees while eating and drinking. When I do risk assessments in employers' locations, what I see often is that the break rooms are really small. Break rooms really, one person in a break room is probably plenty. It's really hard to separate by 20 feet or more when eating in a break room, especially when they're quite small. If you have cafeteria-like areas, it's a little bit easier, but you definitely want that separation while eating. Make sure that you remove seating so people aren't wanting to kind of put those chairs together. Make sure they're separated in tables. If they can eat and drink alone at a workstation, that is even better. Avoid in-person lunch meetings and ordering food or snacks. We want to discourage communal eating and drinking as much as possible. That's where we're seeing a high risk of infection and transmission. What can you do? Routine testing for unvaccinated employees weekly is what we're seeing works well as we're talking about Delta variant. It helps to track and verify. If you're tracking and verifying each employee's vaccination status, it really helps you to see within your workplace, like we were talking about earlier, knowing your percentage of vaccination status is really helpful. Establishing testing requirements for employees who are not fully vaccinated. For example, Atrium Health requires weekly testing for our unvaccinated employees. When employees show proof of full vaccination, then they get to be pulled out of that pool of weekly testing. Plan for those exposures. You know, it's not if, it's when it's going to happen. So develop protocols, and a lot of these have already been put into play for you all from the beginning when we were really looking at COVID and we were in a surge. You know, we're right back in it. So you want to be able to trace very quickly your COVID positive employees. Trace those contacts, notify the contacts of exposure as soon as possible. Testing and quarantine recommendations will be shared shortly. And make sure you're monitoring those contacts through to make sure that they've completed their either quarantine for exposure or isolation if they were positive. Post-exposure guidance. So I get many questions during the day about, okay, well, what do I do in this scenario? And what do I do in that scenario? So this slide is very busy, but we're going to walk through what you're going to do. I love this calendar because what it shows is from the day that you're exposed, the last date of exposure, that is day 0. You start counting after day 0. So please keep in mind, this is how you count on the calendar. At the end of the quarantine or isolation, on day 10, as you can see, you get to leave isolation or quarantine the following day. So let's talk through that. For the fully vaccinated person, testing days 3 to 5 following the date of exposure is ideal. Now, this does look different. Before we were saying anywhere between 5 and 7 days. Now with Delta variant, we know that it replicates really fast. So we want to try to get to those fully vaccinated people as soon as possible. Mask wearing is required indoors for them for 14 days. They'll monitor for symptoms or until they have a negative test. Of course, with mask mandates, that's a different story. The employee should isolate if they test positive. Of course, if they were to develop symptoms of any kind, they would need to be tested again. For that unvaccinated person, testing between days 5 and 7 following the date of exposure is ideal. For non-essential workers, you should send them home and place them on home quarantine for 14 days from the date of last exposure. That's what's recommended by the CDC. However, there are alternate options for the unvaccinated employee. There's a test out criteria where they can return after day 7 if they remain asymptomatic and they have a negative test completed day 5 or later. Now, if they were to develop symptoms, they would need to be tested again. For no test criteria, they can return to work after day 10 if they're asymptomatic and they do not have to have a test. However, again, I just want to remind you that 14 days is what's recommended by the CDC. For the asymptomatic recovered from COVID-19, so they were positive for COVID-19 in the past 3 months, no testing or quarantine is required. Symptoms should be monitored though, and if symptoms were to occur again, then they could be considered for testing again, potentially. However, it's recommended they continue to mask wear indoors. New mask mandates. So I'm sure everyone saw this mandate that came out yesterday, and we were feverishly looking at the computer for any kind of update. The city of Charlotte and unincorporated Mecklenburg County announced yesterday, August 18th at 5 p.m. that through September 1st, there will be a mask mandate for public indoor spaces. It came out later on yesterday evening that effective Saturday, August 28th, that until the positivity rate drops to 5% or officials deem it is safe to lift the mandate, it will be a county-wide mask mandate indoors. Mask mandates for public indoor spaces, just kind of taking it a little bit further, masks will be worn in any indoor public space, place, business, or establishment, regardless of vaccination status. This applies to all those 5 years and older. There are some exceptions to this, and what they're saying is, we're not requiring proof from anyone if they, can't wear a mask. We're just going off of people tell the truth. So what we're looking at for exceptions, though, if there's a medical or behavioral condition or disability, communication with hearing impaired, if you're actively eating or drinking, giving a speech or performance, but you need to try to get that 20 feet of distance like we talked about earlier. Temporarily removing a mask at work if it's determined by local, state, and federal regulations or workplace safety guidelines to be okay. If it impedes visibility to operate equipment or a vehicle, then at that point, the mask could be taken down.
Thank you, Nicolette, for your time today. Great information, and I love the calendar too. Very, very helpful. I'm now going to turn it over to Dr. Steve Limentani. Dr. Limentani is going to talk to you all a little bit about potential ways to address mask and vaccine hesitancy in your population.
Thanks, Ruth. I appreciate your lead in. All of you are well aware of how vaccine hesitancy impacts your workplaces. The health and well-being of your company and the customers is a huge issue. We've been talking this entire time about the risk of outbreaks, decreased productivity, the need to cross-train. It's impacted business travel. And of course, the cost of all of this is very significant. Next slide, please. There are many things that influence vaccine hesitancy. There is a lack of confidence in public officials. There is a lack of understanding of the need for vaccination. I was on a call with an employer prior to this, and many of the questions demonstrate a true lack of understanding of the impact of vaccines and how they work. It also is an issue with access. That as our hospitals fill up, there is less opportunity for people to be hospitalized for things other than COVID. Next slide, please. So as we've talked about, large portions of the population have said no. It's not just one population, it's people in rural settings, minorities. People talk a lot about the far right, but it is also the far left. As we've already talked about, 65 to 70% of healthcare workers have received the vaccine. This has become a significant issue, resulting in systems like Atrium creating an expectation that all people will get vaccinated. I think one of the important things to understand is that hesitancy to receive the vaccine is not just a result of people being stubborn or uninformed. I hear people in a variety of environments utilizing a lot of name calling, but the reality is that there is a lot of information, both in the news and social media, that is very difficult to sift through and quite frankly sounds very relevant to and accurate to the people listening to it. Next slide, please. This isn't new. This slide from 200 years ago for the cowpox vaccine, there was concern at that time that we would turn patients into cows. Today it's chips, but people were concerned over 200 years ago about being vaccinated. Next slide, please. So I put this slide up because this has been a widely circulated video. This is Dr. Dan Strock speaking to the Mount Vernon School Board. I first learned about this when a friend who had many misgivings sent me this video and said, see, none of this makes sense. You shouldn't get the vaccine. And in fact, I listened to this video and Dr. Dan Strock sounds absolutely authoritative. The problem is that a lot of what he says simply isn't correct. Masks don't work. Well, when I was a medical student and through my entire career, when we go in the hospital, we wear masks all the time. We wear masks in the operating room. We don't do it because we like doing it. We do it because it works. He said that you can't get rid of COVID. Well, COVID will probably evolve from being a pandemic to an endemic, but we can certainly impact how it affects our day-to-day lives. He suggested that vaccinated people can get more sick. That's actually not correct. And he talked about something shown on the next slide called antibody dependent. Next slide, please. Antibody dependent enhancement, which is a real thing and has been described, but we have multiple prospective randomized trials that show that that is not an issue in the setting of COVID. Having said that, when he says it on his video, it sounds absolutely correct, relevant, and who would ever want to get a vaccine that would cause all of these problems? But the reality is that's the information that is out there. That's why Facebook recently revealed that they've taken down 18 million posts with information that was not correct. Next slide, please. So we've already talked about this a lot, but I think it's very important to present unbiased information in a clear and straightforward manner. It's also important not to be judgmental. People are trying to do what they think is best, but the reality is, as you've heard from the people speaking prior to me, Delta variant is more contagious. It is almost certainly more virulent, and it is causing another wave. Severe illness is rare for people who are fully vaccinated. More than 95% of the people who are in the hospital now are people who have not been vaccinated. And getting vaccinated continues to be the best way to avoid becoming severely ill. Next slide, please. So encourage your leaders to be vaccine champions. Create a communication plan. Facilitate people asking questions. I think one of the issues is that people become worried when they feel that they're going to be viewed negatively if they ask questions that they have come up with based on what they see on social media. Continue to provide regular updates. It's also important to be honest about what we don't know. This is an evolving situation. There will be new variants and the information will change. Make visible the decision to get vaccinated and celebrate it. Create and publicize a feedback mechanism for your employees to ask questions. Acknowledge that certain communities and groups have been disproportionately affected by COVID-19, and address that some may have significant distrust in the medical system due to past experiences. Thank you.
Thank you so much, Dr. Limentani, for sharing that information with us today. Really important that we offer opportunities for individuals to ask questions and learn. I did want to let all of our participants today know that we do have a number of services at Atrium Health in our Employer Solutions division that can help you meet the needs of your employees as we move forward this fall. We can do and will do on-site vaccination clinics for your teams, both providing COVID-19 as well as flu vaccinations at your work site. As Dr. Passaretti said, our teams are tired in the healthcare space. We've been at this for more than 18 months, and getting as many people vaccinated, not just against COVID, but the flu this year is going to be really important for us to make it through the traditional viral season. In addition to that, we do have the capacity and ability to help you with on-site testing services for both COVID and flu in your workplace. So as you're bringing folks back, if you have vaccine policies or requirements that are asking for individuals who are either symptomatic or asymptomatic, needing to be tested, we can sure help you with that. And then finally, we want to offer to all of you the ability to bring people either on site or do virtual education seminars that will address vaccine acceptance, including answering any questions that your employees might have. We have one employer partner that prior to having some education seminars with their employees had a vaccination rate of about 19%. We did a seminar, spent some time answering questions, having our clinicians really address issues that individuals had. And then within 2 weeks, their vaccination rate had jumped to 49%. Now, we would have liked it to be 100%, but still significantly more than there was in the past. So please let us know if you need help. We are here to help you. I am now going to turn the mic over to Megan Heyer. Megan is going to facilitate some questions and answers that came in and then close us out. So Megan, over to you.
Thanks so much, Ruth, and thank you to all the presenters today. A wealth of information that you shared with us, and we really appreciate it. We do have a few questions that we would like to address with the broader audience. And I know that our presenters have been actively answering them in the chat as well, but just to share the information, I'll start with Dr. Passaretti. Somebody was calling out how, life is kind of still going on, and, we're anticipating with enthusiasm the start of football season and colleges going back and things of that nature, and we're going to have a lot of people really close together. Do we consider those, or are we nervous about those being super spreader events? What are your thoughts around that, or any information you can share?
Yeah, I am very nervous right now, and there's a big disconnect between, and I see this every day when I'm seeing patients or rounding with, healthcare workers or whatnot. They're like, we're living one reality in the hospital, in the healthcare system, where we're inundated with patients, and then you go outside the hospital doors and nobody's wearing a mask, and it's free, everyone's getting together and partying it up. And there right now is a huge disconnect between kind of what the public feels and is seeing to some extent and what we're seeing in healthcare. So I am nervous about these large group events. with Delta, with COVID in general, the highest risk continues to be the more people jammed into a small space, especially if that space is enclosed. So I guess the one blessing of outdoor events is you're in the big wide open. So, at least there's more room for dispersal. But this is a mix of vaccinated, unvaccinated populations, jammed in, eating food, drinking, yelling, shouting, things that can kind of spray aerosol. So I would not be truthful if I didn't say I'm concerned about what the next couple of months are going to bring, and, pleading with the community to, try to be safe and do things like masking that, allow you to maybe do those outdoor events, but not, be as high risk for spreading, increasing cases, increasing the already very heavy burden in healthcare. So, point well taken, point well felt within healthcare workers right now. And I think we're edging into, Mecklenburg County, as was mentioned, now has a mask mandate, at least in indoor spaces. So, we'll have to see how that plays out on a broader scale across a broader footprint in the coming months. And, I hope that our communities can pull together with healthcare and try to do what we can to prevent spread as much as we can right now.
Thanks, Dr. Passaretti. I do want to introduce another person who I'm actually going to direct this next question to. Dr. David Cosenza is our medical director for Employer Solutions, and many of you that have attended our town halls in the past have heard from him. And since he answered actively in the chat a question, I am going to ask for him to respond to this. The question is about testing, and is it a negative test just a snapshot in time? Can you kind of explain how the testing weekly concept works, and this idea of, you could be tested on a Monday and then exposed and then maybe be positive by Friday? So Dr. Cosenza, could you respond to that?
Megan, we may need to have Nicolette respond. I don't know if Dr. C is on. Nicolette, can you respond?
I absolutely can. Thank you. Yes. So that's actually a really great question. So is it a snapshot in time? So it very well could be a snapshot in time, and it could have been that the viral load was too low to even detect the virus at that time when the test was taken. It could be that there was an exposure that occurred after the test was taken. Very much so, yes. So if you can remember, before we were saying, well, you could probably test every 2 weeks, and that's the lifetime of the virus cycle. And so we thought that was working until it wasn't. And so with Delta variant, we've gone to weekly testing to see if we can really try to capture that. So we're hoping that we can get it in the time frame where the virus is replicating quickly and the viral loads are high enough to detect on testing. But yes, that's a great question.
And can I just throw in too, also, testing is never the only thing that you should be doing, right? Like making sure that people are screening for symptoms, staying home when sick, that's always, no matter what frequency of testing you use, that's always going to be super important to reinforce with your employees and whatnot, because, certainly the closer together you do testing, the more likely you are to pick up these asymptomatic cases before they become symptomatic. But, some of the highest risk time frame is at that start of symptoms and while symptomatic. So just make sure it's not this or this, it's, a combined approach, as Nicolette kind of referenced when she was talking about her interventions.
Great, thank you. And thank you for picking up that question, Nicolette. And Dr. Passaretti, as we're talking about testing, somebody from the audience is wondering if there are other variants that are already causing us some concern.
So you may have heard about Lambda, which is the next letter in the Greek alphabet, that has raised some concern. So this is a different strain of COVID that has some mutations that raise concern for potential further degradation of vaccine efficacy against that strain and whatnot. In order for these variants of concern to wreak havoc, they not only have to have the ability kind of to cause different clinical characteristics, but they have to be fit enough to spread well in communities. So Lambda to date has been seen in kind of South America, and it hasn't skyrocketed like Delta was. So while it has some concerning features, it doesn't spread super well in a continuous way, such that it's, as of yet, caused significant concern, but obviously something we're watching closely. And I suspect there will continue to be variants that we need to monitor right now, but no others. Delta is really the one that's, thriving and surviving right now and spreading so widely in many parts of the world. But, as kind of referenced in this question, we're at risk for other variants, especially with kind of half doing vaccination. So the importance, again, of getting our employees, getting our communities vaccinated to back that virus into a corner so it can't, hit that point where it really takes off, really can't be underestimated.
And so, Dr. Passaretti, I'm sorry, I'm not going to let you off the hook yet. Another question around children 12 and under. This is really a hot question that we keep hearing. And do you know of anything that's coming our way for children 12 and under as it relates to vaccinations?
Yeah, so anticipation is that that Pfizer, Moderna will have information to go in front of the FDA. I've heard as early as September 4th, and then it'll go through the FDA and ACIP process. So I think anticipation is October, maybe November, that we'll hear about approval for ages 5 to 12. And hopefully, very rapidly thereafter start to be able to vaccinate that younger population. So hopefully in the very near future, more to come. The good and bad of being in the middle of a surge for vaccine studies is that you have lots of cases to look at and see the impact of vaccination, which helps you kind of meet your goals for how many you have to kind of look at that are both vaccinated and unvaccinated to be able to show benefits. So with this recent increase, that's the latest I've heard. So I'm hopeful it's not too far off. Unfortunately, it will be after the start of the school year. And I think the start of the school year is going to be very challenging in some areas. So, I personally am a believer that, masks in the school systems are an important adjunct for right now. There's been, yesterday, I think a JAMA article came out showing children to adult transmission within households with Delta and the age ranges and whatnot. And we know kids can spread to other individuals, and, the importance of making sure they're not having widespread spread within the school system and then taking it home, taking it into the community, I think is going to be very important over the coming weeks.
Thank you. And so I'll let you take a little breather, Dr. Passaretti, but I do want to tag on to the conversation about children and in the last minute or so, Diane, this concept of kids going back to school and spread, how are we at Atrium preparing for the impact this could have on teammates throughout the system?
Yeah, great question. We're talking to our leaders about, first of all, sharing their story, why they got vaccinated and why it's important to them to be vaccinated, because I think the more you hear that from, just real people, the better off, our folks are going to be in making that decision for themselves. We are asking our leaders to be flexible with teammates, to listen to their teammates and kind of adjust schedules if they need to, very similar to what we did in the past year where, where folks were allowed to work remotely if they could, to, adjust to different school schedules and things like that. So, I think everybody is got their hearts in the right place, and, as long as you're listening and trying to problem solve with your teammates, you're going to end up in a good place.
Great, thank you. So we have entertained all the questions in the chat this time. So thank you all for your attendance and participation in our town hall. If you have more questions, please make sure you reach out. We'd be happy to entertain more. If you need any information, let us know. And any topics for future town halls, we're always open to suggestions. So please let us know, and thank you for attending today.